and welcome to the Gastrointestinal Facility Outbreak Guidelines for Residential Care and Healthcare Settings Education Webinar. The joint presentation between the Communicable Disease Unit and Infection Prevention and Control. I'm Michelle Andrews, PD Specialist at the CD Unit. The other three you will hear during this webinar is Nikki Gill, Infection Prevention and Control Educator. Gastrointestinal Infection Outbreak Guidelines for Healthcare Facilities, October 2017. This webinar, recognition, report, react, and be ready. So early recognition of GI infection outbreak, prompt reporting of the outbreak to the CD unit and appropriate people. Swift action with appropriate outbreak control measures, being ready, be prepared at the beginning of the outbreak season with the right supplies, and using practices and good hand hygiene at all times to prevent outbreaks before start. During the webinar, we will outline communication pathways for outbreak management, review action control practices to prevent outbreaks from happening, and if you do, have the outbreak over as soon as possible. The outbreak guidelines have been reviewed this year. Any changes have been made, some of them small, but the overall goal is of reducing the number of days facilities are spending in outbreak. So we need to recognize what is a gastrointestinal or GI infection. GI infections, illnesses that are caused by diarrhea or vomiting. They cause diarrhea or vomiting. They can be caused by a bacteria like Salmonella or a virus like norovirus. The most common cause of GI outbreaks in residential care is norovirus. How do GI infections spread? They basically are transmitted between people via the fecal-oral route. Contaminated poop or vomit gets into your mouth. So this happens through either direct contact, touching your mouth or food with unwashed hands after direct contact with an infected person or their vomit or stool. And through indirect contact, hands after contact with a contaminated object or shared equipment that is not cleaned after each use. It can also be spread through possible aerosols that are created when an infected person vomits or during toilet flushing and the things get into your mouth. Spread through ingestion, eating or drinking contaminated food or drink. It's by hand to mouth after the hand has been come in contact with a contaminated surface, or by shared equipment that is not cleaned after each use, such as a thermometer or a pulse oximeter. So we recognize that a GI illness or infection is happening in a resident or a patient. It's recognized through diarrhea or vomiting. So if you notice 3 or more residents or staff with diarrhea or vomiting in a 4-day period, it may be a GI gastrointestinal infection outbreak happening. Report to your supervisor. Consider that a GI outbreak might be happening. Official case definition for a GI infection is when one of the following conditions occur that cannot be attributed to another cause. 2 or more episodes of diarrhea in a 24-hour period above what is normal for that person. Or 2 or more episodes of vomiting in a 24-hour period. Or 1 episode each of vomiting and diarrhea in a 24-hour period. Or a positive culture in an individual for a known enteric pathogen with symptoms of GI infection. So that person has diarrhea or vomiting as well. And finally, 1 episode of bloody diarrhea in an individual meets definition for a GI infection. When the case definition and considering if individuals meet the definition, you need to rule out other causes for their symptoms. Check a resident or the patient's chart to see if the illness could be attributed to a laxative use or a medication that's just been started, a new or prior medical condition. Near to the GI outbreak guidelines, a new definition, the potential outbreak or alert stage of a GI outbreak, defined as when one or two suspected cases of GI illness occur within a 4-day period within the same setting. What we need to do is implement droplet and contact precautions immediately when providing direct care to any symptomatic residents or patients. You need to separate symptomatic residents or patients from the well ones. Monitoring and recording of GI illness among the remainder of the residents or patients and the staff within the same area. Taking action at this time is to prevent a full outbreak from occurring. The official definition of a GI outbreak is 3 or more cases of GI infection occurring within the same setting at a ward, a wing, or a facility in a 4-day period. So if you have 3 cases within 4 days in the same setting, it's a GI outbreak. So this year again is the management of the outbreak amongst facilities. Residential facilities and acute sites managed by the facility ICP. The ICP will consult with the HO or the medical director of infection prevention and control per the GI outbreak guidelines. Private and P3 residential facilities will continue to be managed by the CD unit. The CD unit will consult with the HO as per the GI outbreak guidelines. Afterwards, however, all residential facilities will call the HO directly. Acute will call the medical microbiologist on call through the hospital switchboard. New this year again is, if you think there's a GI outbreak happening in your facility and you are an IH residential facility or an acute site, contact your facility ICP. If you are it or a P3 residential facility, call the CD unit. So it is important to report when an outbreak is happening. All and facilities will continue and must report the outbreak to the IH Communicable Disease Unit, completing Section A of the RI and GI Outbreak Report Form and send it to the CD unit, either through email or fax. IH residential facilities and acute sites, please send a copy of this form to your ICP. New thing this year is that we have revised the GI and RI Outbreak Report Form a little bit. The 2 main changes are, at the top of the form, you will be indicating what type of a facility you are, private, P3, or Interior Health Facility. And really, we are asking you to please report the number of cases hospitalized and the number of deaths occurred that are attributable to the outbreak. This remains as a fillable online form that can be emailed to the CD unit, but also be printed out and filled in by hand. Official report. On the GI and RI outbreak report form, please complete the type of outbreak. So you would be checking off the GI box here. Complete the date, the name of the facility, type of facility. Indicate outbreak location is just on the 2nd floor or in a certain cottage, or indicate if it's in the entire facility. So let us number of beds in the outbreak location. Complete the person reporting, the best phone number to contact that person, and then the phone number for the facility as well. report, you need to complete Section A, Initial Reporting Information. The onset date of the first case, the date outbreak is being declared, and the total number of cases on the day the outbreak is being declared amongst residents or patients, and as well as the total number of people living or working in the outbreak location. So residents or patients, and those were staff. Now, this staff number is the total number of staff who are hired to work in the outbreak area. It's not, for example, the number of staff who are working there on one shift. And then finally, complete typical symptoms that you are seeing amongst the cases. So the GI symptoms you may be noting: diarrhea, vomiting, abdominal pain, nausea, headache, or fever. Here's an example of initial report form for Shady Pines facility. Nurse is the person reporting, and she has indicated the type of outbreak is a GI outbreak. She's reporting it on October the 4th. This is Shady Pines in Arizona, and it is an IH facility. The look outbreak is the entire facility. Number of beds in the location are 60. And it has her name, her phone number, and the phone number for the facility. Completed Section A. So the onset date of the first case was October the 2nd, but the outbreak was declared on October the 4th. So dates are included. Total number of cases amongst residents or patients is 6, and staff is 1. The number of people living there is 59, and the total number of people working in the outbreak location is 30. She's got typical symptoms that she is seeing amongst cases. They have diarrhea, vomiting, abdominal pain, and nausea. You will note that the total number of residents in the outbreak location is 59, but the total number of beds is 60. There is one bed that is vacant and not. So as well in the GI facility outbreak guidelines this year, the Outbreak Declaration. For residential facilities and acute sites, they will no longer be declaring GI outbreaks themselves. On residential facilities, the outbreaks will be declared by the facility ICP, consulting with the MHO as needed. P3 residential facilities, the outbreak will be declared by the CD unit, again consulting with the MHO as needed. And at acute sites, the outbreak will be declared by the medical director of IPAC in consultation with the infection prevention ICP. Also this year is the Outbreak Management team. So, preparation for outbreak seasons, facilities should ideally create an OMT by the Director of Care or the most responsible person at the facility. Members of this team could include the HO, the IH facility ICP, a CD specialist from the CD unit, a facilitator, a Director of Care, a charge nurse, housekeeping, or a food services representative. The purpose of this outbreak management team is to be constantly reviewing outbreak control measures so the outbreak can be declared over as soon as possible. Also, in terms of reporting, it's important to notify the following partners that an outbreak is occurring within a facility or acute site. The commuter licensing officer, CIS administrator on call, the manager, care coordinator or designate, the director of the facility or other positions, the staff office, hospital facilities where some residents may have recently been transferred to, and other service providers you deem necessary to notify, such as patient transport services, oxygen services, lab services, etc. Basically, if you note an outbreak is happening, report person with the highest level of administrative authority at the outbreak is suspected, such as administrator of call, your patient care coordinator, etc. Refer to the GI outbreak guidelines, roles and responsibilities for more details. So daily reporting is the next important thing. You've told that initially an outbreak is occurring and have sent in the initial report, but daily reporting of the outbreak is required during outbreak to CD unit. So while completing Section B of the RI and GI outbreak report form, complete it daily, fax it, or email it to the CD unit. Each residential facilities and acute sites must send this form as well to their ICP. Daily reporting consists of filling out Section B. You include the date of onset of the most recent case amongst the residents and staff, if applicable. You include the number of new cases in the last 24 hours amongst patient residents and staff. You will include any number of cases misidentified and removed or added patients, residents, and staff. Finally, include total number of cases to date amongst residents or patients and staff. And then this year, as well, again, is the daily reporting of the total number of cases hospitalized over 12 hours to date here amongst residents or patients, and total number of deaths directly attributed to the outbreak. We are asking you again for the daily total number of vacant beds in the facility. Example of daily reporting. Again, any nurse has completed the first top section that we know that this is coming from Shady Pines. She has the date, it's the next day, October the 5th, and she's completing as before. But she has completed Section B, the daily outbreak reporting section. The onset of the most case among residents is October 5th, and also for staff on October the 5th. The number of new cases in the last 24 hours amongst residents was 2, staff is 1. And you've noted that the pre-day had 6 residents and had reported 1 staff case. Today, there are 2 new resident cases in the last 24 hours, but one initial resident case was removed as our chart review showed that he wasn't actually meeting the case definition. So the total number of cases amongst residents to date is 7. 6 first day, plus 2, and then removed, so it's 7. Amongst staff, 1 case was reported initially, and now a new one on October the 5th. However, the member has discovered that another staff member who called in sick 2 days ago is also the case, so it's having to be added this time. So the number of cases amongst staff is 3. 1 plus 1 plus on the initial report form, so that's 3. Also reporting to us that 1 resident go and be hospitalized as of today. She's completed 1 here. We've noted that as of today, on this day, the total number of vacant beds is still 1.
Now that we've done the reporting, we're going to go on and collect lab specimens. All the PHSA lab at BCEC in Vancouver needs to be notified that an outbreak is happening at your facility. So in order to notify them, you need to go to the quick reference guide, and it will have a link to the notification form that needs to be sent to BCCDC. It contains the information on how to fill in the form. This is what the form looks like. How to identify that you have an outbreak. So it has the outbreak identification instructions on the back of the form. You complete the facility, the ward or neighborhood, and the year, and that will be the outbreak identification. So an example here is Coastal Lodge Unit C 2017. To collect specimens, they can also be listed on this form here. Specimens of our stool or vomit from the case, there is the PSA GI outbreak requisition that needs to be completed for each specimen that's sent. Specimens need to be collected within 3 days of symptom onset. An example of the form is here. And we need to include under additional copies to the unit, and they have an actual number that's entered here, and that's so that they get the results. And so the outbreak identification needs to be, or name needs to be on requisition as well. So that's the same ISIN number that you use to let PHSA know that there's an outbreak happening. So collect specimens, or actually before we collect specimens, we need to react in appropriate ways with control measures. So we've already, if we've identified a case, implemented droplet contact precautions for each symptomatic person. And they need to be on the droplet contact precautions for up till they're asymptomatic for 48 hours. Protective equipment that needs to be worn include gloves, gowns, procedure mask, and eye protection. And just remember that the outside of your PPE is contaminated, so it needs to be removed and your hands washed before leaving the area that you are working in with the person who's sick. The symptomatic resident or patient in acute, we try to put those people in a single room that has their own toilet and sink. And if not possible, we cohort with patients with the same symptoms and limit movement that the patient is to stay in their room, so not letting them out to smoke. Hopefully they're sick to do that. In residential, what we do is we try to keep the residents in their room if possible and serve their meals in the room. Designate toileting facility because sometimes these rooms are shared, so make sure that if they are, that ill person has their own commode, bed. Look at discontinuing group activities in the outbreak location, and if a transfer of a resident is required or a medical appointment, notify the receiving facility and transport services that an outbreak is happening at your facility. This is here about readmission or repatriation of residents from acute back to their facility. The medical health officer must be consulted, and so for IH residential facilities, this goes through the facility infection control practitioner, who will consult with the medical health officer in regards to admissions and repatriation. If it in P3 residential facilities, the C unit who will work with the medical health officer, and after hours, medical health officer needs to be contacted directly at their call number. And for staff, if staff are sick with a GI illness, they need to stay off work for at least 48 hours after symptoms have resolved. And for staff who are not ill, have been working in the affected area, they can work elsewhere as long as they have no symptoms of GI illness. Visitors and volunteers, there's signs put up to limit visits to friend and family only. There's hand hygiene at the entrance and instructions for visitors to do their hygiene, and often volunteer activities are canceled during an outbreak. And of course, ill visitors should not visit. Food services, basically washing the dishes in hot water and detergent is appropriate for control measures. And important is to remove all food items from the resident and staff areas. This includes the nursing station. There shouldn't be any open food. In regards to cleaning, the areas contaminated with vomit or feces must be cleaned and disinfected immediately to a radius of 2 meters. Increase frequency of cleaning and disinfection, in particular the high-touch areas, cleaning them at least twice a day. Things like handrails, toilets, bathrooms, elevator buttons. And the disinfectant product is changed to either a 0.5% accelerated hydrogen peroxide solution or a bleach solution. And remember to wear your personal protective equipment when you're cleaning the area. Remove it, wash your hands immediately, and carry on.
Again, this year is declaring the outbreak over. So GI outbreaks can be declared over when 96 hours have passed without any new cases occurring in the facility. So for IH residential facilities, the facility CP will declare the outbreak over, consulting with MHO as needed. Private and P3 residential facilities, the CP will declare the outbreak over, again consulting with the MHO as needed. Now, acute sites, the CP will consult with the medical director of IPAC to declare the outbreak over. So when declaring the outbreak over, again, it's important to fill out the RI and GI out report form for the last time. All facilities and sites must notify the CD unit that the outbreak is over and complete Part C of the form. Facilities and acute sites need to send a copy of this form to facility ICP as well. Section E, the outbreak being declared over. Complete the date of onset for the most recent case in the facility, the date the outbreak is being declared over, and total number of cases amongst patients and staff. Example of the final report, the GI and RI outbreak report forms have been completed again by Annie Nurse. The section, as per usual, but they've changed. It's now October 11th. Section C, outbreak declared over. Annie has completed the date of onset of the most recent case in the facility, October 7th. Is being declared over October 11th. There were a total of 8 resident cases within the facility during this outbreak and 3 staff cases. Completed this form and faxed it to the CD unit and sent a copy to the ICP because Shady Pines is an IH facility.
So we just remember we're ready for the next time, and a lot of residential sites have outbreak kits or boxes available. Keep specimen collection kits on hand at all times, and that you have the appropriate disinfectant in stock and staff are trained to use it so you have it readily available. In your outbreak box, have your extra PPE available, the specimen collection kit, guidelines, and documentation tools. If you have already on hand, it's much easier when an outbreak happens. Provide yearly outbreak education to staff, this session is being recorded. You'll be able to use this. And in our regular care, to use routine practices and hand hygiene diligently to avoid outbreaks from happening. In regards to ordering specimen collection kits, there is a requisition that you send down to the PHS lab. And you can find this requisition in the guideline, a link to it. It's also in the toolkit underneath tools and forms, which will during specimen container order form. The reference for GI outbreak guides in healthcare readily available in the toolkit as well. It's also available on the public website. For our P3s and private facilities have easy access to.
So just review the resources that are available to you under the Outbreak Management Toolkit. It's hosted on the Communicable Disease Unit webpage. The links are also in the to the toolkit are also in the infection control manual. Access to the information is on the inside net as well, and non-NIH facilities can access these tools on the public website here. One I and one for RI. As included in these locations is the summary of changes to GI outbreak guidelines for healthcare facilities. So all the changes we've reviewed today are summarized within this document, and it is also accessible on the through the toolkit. And that's the end of our session for the GI outbreak guidelines for healthcare facilities. Thank you.